We are here in Indonesia, which will be the home of the HIMSS22 Asia-Pacific Conference happening on 27 and 28 September this year. In the lead up to the conference, HIMSS wanted to take a look at the state of digital transformation in Indonesia's healthcare scene. We'll be speaking to key stakeholders in the country, understanding the challenges and finding out what needs to happen to advance digital transformation. But first, a little about Indonesia. Indonesia is the world's fourth most populous nation, home to about 280 million people. In 2020, it was reported that the ratio of physicians to population stood at only 0.38 physicians per thousand population, while the ratio of hospital beds to people was at 1.2 per thousand population. These numbers are among the lowest in the Southeast Asia region, and the pandemic further placed a strain on the country's health system. The existing healthcare infrastructure in Indonesia is insufficient to deal with the increasing demands for healthcare services. For many countries, COVID-19 brought to light the role that digital technologies can play to lessen the strain on overwhelmed health systems. Indonesia's experience was no different.
COVID-19 teaches us in this pandemic situation that technology is very important. So the technology support the services to the COVID-19 patients for the whole country in Indonesia. You can see in the Peduli Lindungi or tracing testing for the whole populations. It's mean using technology as a backbone of the services to increase the healthcare quality. After we using the awareness to all the hospital. So I would like to thank to the HIMSS to introduce the collaboration between the hospital, Minister of Health, Indonesia Minister of Health, and also the BPJS, and all the stakeholder in Indonesia is more aware about the technology is take a big part of the services, especially in the increase the outcome to the patient. So I think more hospital in Indonesia is more aware that using the technology can help them to implement what is meaning about the patient-centeredness.
A small number of early adopters are leading the way in digital transformation in the country. Among them is Pondok Indah Hospital Group, which made history in Indonesia by being the first to achieve HIMSS MREM Stage 6 in March this year. With this achievement, it joins a group of organizations across the globe who are committed to operating in a near paperless environment and who use EMR technology to drive transformational change in all aspects of hospital care. Let's take a look at their journey to Stage 6 and find out how this has impacted processes and outcomes.
MRAM Stage 6 validation is not about software enhancement or hardware addition. It's about improving the business process to achieve increased patient safety, patient satisfaction, and of course, overall quality. So, for example, to implement closed-loop administration, we have to really create a solid team between IT personnel and then doctors, nurses, and somebody from the accounting to really work together and create a good process that can be implemented smoothly to the operation. So it's all about teamwork.
What are some of the key outcomes you can share with us since your digital transformation?
One of the main impact is improved communication. We are in an industry where communication and information are really crucial. Digital transformation allows information to transfer efficiently and faster. Because of that, we can cut waiting time in many areas. For example, in outpatient pharmacy, we can cut by 30%, and we also can reduce the turnaround time in laboratory result by 50%. Another outcome that I would mention is increased safety practices. To take medication management as an example, we implement clinical decision support. It triggers an alert for allergy, for drug interaction, duplication, so physician can prescribe medication in a safer way. In order to achieve MRAM stage 6 validation, we have to implement closed-loop administration. And closed-loop administration means we have to QR code all the administration of medication and breast pump milk. Currently, we have already achieved 90% for medication and 100% for breast pump milk.
During the validation, HIMSS commended the hospital group for its recently introduced closed-loop administration processes on blood and blood products, human milk, and medicines administration. The use of RFID or QR code scanning for medicine prescription, storage, and administration of pumped breast milk in nursery and NICU, as well as blood and blood products transfusions, helps reduce the risk of human error and improves patient safety. The hospital group was also able to show good examples of the alerts and warnings associated with electronic prescribing. There are automatic alerts for patients with certain conditions when doctors prescribe specific medication, either in outpatient clinics, inpatient, emergency, or ICU. Examples of alerts include those for patients with drug allergies, patients at risk of contraindicative medicines, or patients who are pregnant. Additionally, the actions based on the warning, whether to modify, cancel, or override the clinical order, are clearly documented. What is happening at the hospital level is just one piece of the puzzle when it comes to digital transformation here in Indonesia. During the pandemic, technology companies and startups, or what is referred to as born digital players in the healthcare ecosystem here, played a vital role in keeping Indonesians safe through telehealth services. For example, the Indonesian government saw that these companies could help ease the pressure on hospitals and partnered with them to provide free telemedicine services to patients with mild COVID-19 symptoms. Through these companies' apps, citizens could access services like teleconsultations with doctors, have their drugs delivered to them, get healthcare information, or make appointments. One of the most successful players in this field is Halodoc.
If you compare where Halodoc was before the pandemic and where we are today, obviously it's very significant in difference. I think we're talking about 1,000% of growth on a monthly or weekly basis. So I think it's very significant. What I can share to you is that today we have over 20 million monthly active user, and obviously before pandemic, I would have never imagined that we would reach millions of user on a monthly basis like what we have today.
How do you see yourself evolving in this post-pandemic world? And what is the role you see yourself playing in Indonesia's healthcare ecosystem moving forward?
I think the biggest role that we play would be access. Now, access comes in different kind of forms. Those people in rural area, they really don't have the right access with doctors or specialists or the medicine. We will definitely play a big role on that access. But for those that living or has the fortune to live in the bigger cities, then I think the kind of access that we provide will be ease of use, ease of comfort of meeting a doctor, physical, how appointment management will be part of the solution that will stay forever, and also the combination of payment that is required that might not be there before that now comes. And I think during the period it has been, the government have shown tremendous support of a public-private partnership between digital players and the government to support for patients. So I think we will play a big role in that part of the glue between between public-private partnership for the benefits of patients.
As we mentioned earlier, COVID-19 resulted in a shift in views regarding the positive role digital technology can play in healthcare, and this was a fact that was not missed by the Indonesian government. The country's leadership has committed to digital transformation, and this was exemplified by the launch of the Digital Health Transformation Strategy Blueprint 2024 late last year.
Actually, we face some issues about healthcare digitalization in Indonesia, not only about the data itself, We have a lot of data, but not connecting each others. And we have also some issues about the healthcare workers, like digital literacy for that. And we have many applications used by each healthcare facility. For example, in the hospital we have around 50 applications, and then in the primary care we have around 70 applications. You can imagine how the burdens for each health workers to input some report every day. Actually, these strategies have three strategies or have three priorities. First, how we can integrate it, all of the data we think about the personal medical records, to put from each healthcare facility and then use it for improve our delivery services. Not only to think about the early warning systems, predictions, forecasting, and etc. And then the second prioritize is how we can simplify the applications. I already mentioned about the numbers, and we make it simplify. And then the application itself, the target is not for the report, but to improve the services. And then the other thing is to build the capacity for the health workers, not only in private but also in the governments, especially in the regionals, to improve their capacity to use and to prepare. This is the technology era, so every health workers ready to use the digitalization and ready also to analyze the data itself. And then the last priorities is about the ecosystem itself, because as you know, the pandemics have given me some experience, how the collaboration is important, not only to engage all parties, but also together to align within the strategies, our strategies and our goals to all the stakeholders. With this ecosystem, we hope can make the ecosystem can grow, and also to support the telemedicine, virtual health more common, not only when COVID but also after the pandemics. So we make some acceleration for telemedicine, not only in terms of the technologies but also the regulation itself. So we built the sandbox regulatory to make sure the innovators, the startup comply, not only with our regulation but also comply with the clinicians, and also they keep the protects their data for privacy.
While the country's healthcare scene is still in the early stages of its digital revolution, the Indonesian experience can still offer many insights to health systems around the world who are recovering from the pandemic and on their digital transformation journeys. These, and a lot more, will be among the conversations happening at the HIMSS22 Asia-Pacific Conference in Bali this year. The two-day conference on 27 and 28 September will center discussions on care, data and connectivity, and how we can create stronger and more resilient health ecosystems. HIMSS will be co-hosting the event with PERSI, a non-profit umbrella organization of 18 hospital associations in Indonesia. Dr. Grace, PERSI is working with HIMSS to advance digital transformation here in Indonesia. Can you speak about what this partnership involves?
This purpose of the collaboration between PERSI and HIMSS is to agree that PERSI and HIMSS is a affiliation organization that will bring awareness on IT health for healthcare workers in Indonesia, especially in hospital, and then there's a capacity building and community engagement. This partnership involves, but not limited to, sharing international content and then engaging local communities to enhance knowledge sharing, and then bridging educational and content gap, also for promoting international and national standard and framework. Also there's a conversation around the policy and implementation. To all fellow professional healthcare around the world, please do come to HIMSS22 APA Conference in Bali because it will help us to accelerate the digital transformation in healthcare, and also you can learn about Indonesia healthcare system, especially Indonesia medical tourism.